Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension, why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today.
Hi, I'm Dr. Mohammed Sharif, consultant physician in KTC Kumla Hospital. So I'm dealing with the hypertension in this when we are celebrating World Hypertension Day. I'll be talking about hypertension.
So, doctor, by now we all know what hypertension is. But can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
Most of the patients we don't have any symptoms due to hypertension. We'll understand the symptoms of hypertension when there is target organ damage. So most of the patients who comes to a clinic or hospital, they will be they will be having hypertension. So most of the patients who is having heart disease, kidney disease, they will be having BP. So if you doesn't check your BP regularly, it can cause serious organ damage like stroke, kidney failure, heart attack. So according to WHO, out of five, four people won't be seeing the managing. According to WHO, out of four patient, they won't be seeing BP and they will be having the end organ damage. So it doesn't mean that if you doesn't have any symptoms, you doesn't have any hypertension. You have to see hypertension before any organ damage occurs.
Okay, but why is it so often called the silent killer? What makes it so dangerous over time?
As I said, we won't be knowing the effect of the BP for a long time. It is a long-term ill effect. It causes BP. So once it can lead to kidney damage, stroke, heart attack. So if you check the regularly BP, you can prevent the end damage. So you have to consistently check the BP. So it is called silent killer. So in India, around 57% of people who is having stroke and 25% of the MI is having hypertension.
So, doctor, I would like to know what are the most common reasons people develop high blood pressure? Is it genetics, lifestyle, or something else?
Yeah, in hypertension, around 90 to 95% it is genetics and lifestyle. It is also called primary hypertension. And around 10 to 15% will have secondary causes. They are mainly because of if you are having heart, kidney disease or hormonal disorders. So most of the time it is due to primary. If your parent is having BP, so there is more risk of you developing the BP. So we have to see the family history. We have to see any kidney disorder is there. Then we can treat accordingly the patient.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
So reading in that mainly two things are there. One is systolic, which is upper, and diastolic, which is lower reading. So according to American Heart Association, when it is consistently above 130/90 millimeter mercury, we can diagnose him as a hypertension, him or her as a hypertension. So when consistently it is above 130/90, they are called as hypertension. We can treat for hypertension.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
So when patient is having first time where he is found hypertension, the few things we can do is we can decrease the salt intake, that is below 2.3 gram. You can keep around 1 gram per day. And if you are obese, you can lose weight around if you lose weight 10 to 15%, or if you lose weight, it can also decrease the blood pressure. And other is, if you are having dashed diet, that is, if you increase the vegetables, fruits in your diet, that can also decrease the BP of a patient. And if you exercise, if you are having a good lifestyle, it can also decrease around 10 to 15% BP.
Can we say that hypertension can be treated without medication?
If the patient is having mild or early hypertension, lifestyle is enough. But if you are if patient is having consistently above BP, or if he or she is suffering from diabetes or some kidney disease, then you have to start the BP medications. But once one or the other day, you have to start BP medication if it's high, consistently high. So if you are adding lifestyle into your medications, then it is the best way of treating the hypertension.
Okay, doctor, you just talked about medication right now. So I would like to know, what are the most common side effects that people should look out for while taking medications for hypertension?
As you know, each hypertension antihypertensive drugs is having side effects. Suppose you are taking diuretics, it can cause hypovolemia or low potassium level. So if you are taking beta blockers, then you can experience fatigue. If you are taking AC inhibitors, it is one of the side effect of it is cough. So there are few side effects each drug is having cause. But it doesn't mean that you have to stop these drugs. You have to consult your doctor, and you can adjust the drug, and you can adjust the dosage. So that is the way of treating these side effects. You have to always report these side effects to your consulting doctors.
Okay, I have a question related to that only. Let's assume that somebody's blood pressure is coming under control. Can they come off medication, or is it a lifetime commitment?
Yeah, sometimes, especially if your weight and lifestyle is maintained, you can sometimes stop these medications. But we have to use lowest dose of the antihypertension medications. But thing is that, yeah, I'm telling, like, you can, if your lifestyle is managed and you are frequently checking the BP, you can sometimes stop these medications.
Okay, when you say reassess regularly, how often people should check their blood pressure, and what's the best way to do it right?
If for uncontrolled, or if BP is very high, you have to check daily for 1 to 3 days, for first 3 days. That is preferably better in the morning and in the evening. If it is controlled, BP is well controlled, you can check once or twice in a week. So when you are checking the BP, you have to sit calmly for 5 minutes, and you should not have any coffee, or you have to smoke before checking the BP. So that is the one condition you have to do when checking the BP.
I would also like to